Hello again, and thank you for joining us for this lecture. We are going to talk about the paravertebral block and the rectospinal plane block. And so what is very relevant about this block is finding the surface anatomy. An easy way to do this is to, if the patient is slender, palpate the spinous process and then place the probe next to it sagittally, and then you're going to get the view right away, in which you can appreciate both transverse processes. But if this is difficult, then we can move the probe more laterally and find the ribs, and we can start counting the ribs. And we go counting the ribs from top down, when we can see the first rib, then the second, third, fourth, fifth, sixth, seventh, eighth, ninth, 10th, and then the 11th, and then I'm placing my thumb next to that spot and I'm getting more gel so then I can find the 12th. Now the 12th has a different structure, it's much more vertical and it will seem slender. Another way to do this is to also find the tip of the scapula, and then that will be at the level of T7. We find the transverse processes, and once we have visualized a transverse process, we try to find the next one. At this level, we're going to see the muscle layers that are the rhomboid in some cases, the trapezius, and then the rectospinae. Now, we are seeing the transverse process, and we ask the patient to take a deep breath. If we rotate the tail medially, so he can show us the pleura. We can also see the muscle structures between the transverse process. So we have to be mindful that if we decide to go with the needle in plane or out of plane, if we park ourselves between the transverse process in the muscular plane, we are going to be doing an intertransverse plane. And if we decide to go anterior to the muscles and behind the pleura, then we are doing a paravertebral block. Another alternative for this block is to do it in plane, and in plane we have to first find our spinous process. In this case, we're rotating the probe so we can match the image that we have. So we are seeing the spinous process to the left, and in the center of the screen, the transverse process. On the right side, we see the pleura. Now, what we have to remember is that it's a difficult block because we can see the rib as we just did, and we would need to approach this from the lateral aspect to the medial aspect. And as you can see, I'm stabilizing my probe with my left hand to try to keep the probe in place. The moment that we let go of the probe, this becomes very unstable, and then we can find the rib or find the space, and it's slightly difficult to do. So it is not a complicated way to do this block. It is a fantastic way to see the needle in plane, but then we would have to do this at different levels as well. And as you can see, you can lose the view very easily. For this reason, we want to go back to, again, palpating the spinous process, placing the probe sagittally, and then we see the transverse processes, and then we see the muscles in between. We can see slightly the costotransverse ligament there. So, and again, we are seeing it better in this image, and we can also see the pleura underneath, and this would be the ideal view to do your injection. Now we are making the resident perform the block, and what we asking the resident is to find the midline. So he is finding the midline by seeing the spinous process shade. So he's able to find the spinous process, but the view is not optimal. So we are going to ask to try a different probe. Now that we have a new probe, we are going to ask the resident to, again, place it horizontal so he can find the spinous process if the patient has more fat or larger muscles. Once you find the spinous process, then you have your midline, and you can see an outline that looks kind of like the outline of Batman flying. You can see the head of Batman, the shoulders of Batman, and then the wings that are being displayed. Now we're pointing out right there at the transverse process, and then the rib is on the side. Once we have found that, we can go sagittally and start looking for the transverse process. So when you are disoriented, the best thing that you can do is start finding the ribs. You have to find the rib. So if you move laterally, not only you can count the ribs, but you see the ribs that are going to give you the location you might add. So once you have found the ribs, you can adjust your depth to get a better view. So you identify the ribs by seeing the curvature of the ribs. The ribs are slightly more cylindrical than the transverse process. And on top of that, you are going to be able to see the pleura underneath. The movement of the pleura is going to resemble water hitting a beach. So this is a good thing to remember to see that movement. Now we can start moving medially, and then as we move medially, we can start identifying flatter structures, and these flatter structures are going to be the transverse process that are appearing there. So those appear to be transverse processes because they're flatter. All right, so we have two transverse processes. You can come from cephalad, from caudate, or out of plane, but we are trying to open that space. And if we have a circular injection, that means that we are in the muscle. If we have an elliptical, that means that we are in the facial plane. Now we can go at that level and inject local anesthetic there, and that would be the intertransverse process block, which would be almost as effective as a paravertebral. It's safer. Now, if we are able to visualize the pleura, then we can advance beyond those muscles and push the pleura away, and the pleura is visible at this point right there. So if we are able to push the pleura away, then we are doing a true paravertebral. And again, we might have to repeat this at different levels, but we're going to obtain better anesthesia. Now, if we are behind the costotransverse ligament that was just pointed there, then we're doing an intertransverse block. The intertransverse block will also be effective given the septations that we now know exist in this space. So these are all of the potential options. Thank you for your attention.